As Women's Month wraps up, one key industry often overlooked in the healthcare sector is women in homeopathy.
Homeopathy is seen as an alternative to established medication, but some herbal medicines are still used alongside traditional medicine, especially when you look at the African and Asian contexts. Ahmed Kajee breaks it down.
Women in healthcare, along with many other professions, face difficulties breaking through glass ceilings in their respective fields. However, the challenge is more pronounced in fields such as homeopathy compared to traditional medicine. Homeopathy can be used for many medical conditions, including polycystic ovarian syndrome, thyroid complications, headaches and anxiety. Co-owner of the Healing Sanctuary in Rosebank, Dr. Zara Kajee, says treating symptoms is one of the core pillars of homeopathy treatment.
We often make the comparison that the substance or the ingredient that will elicit a reaction in a healthy individual can be used to cure that same reaction in a sick individual. So how we would apply that is in an individual that has insomnia, for example, or anxiety. We'll then give them coffea, made from the coffee bean, that has been diluted and potentized according to homeopathic principles.
Meanwhile, co-owner Chanel Martin says there are many preconceived misconceptions, including high costs, longer treatment times, and that it can't be used alongside traditional medication.
People don't really know what it is all about, and also they think it's expensive and it's inaccessible. And that is part of our mission here, is to make it very accessible to the whole public. Anybody and everybody can be treated, and with great success.
Successful homeopathy was also mentioned at the BRICS summit by India's Prime Minister Narendra Modi.
All our countries have traditional medicine ecosystems. Can we together create a repository of traditional medicine? Excellencies, under South Africa's presidency, countries of the Global South have been given special importance in BRICS.
Martin says it would be helpful for the sector on a global level.
A repository would help because I think that way we can grow it globally, not just here in South Africa.
Despite the optimism, Martin addressed challenges of being a woman in the sector and the challenges of homeopathy not being seen in the same light as mainstream medical treatment.
Because it was a male-dominated career path, it's a bit more difficult to then see women in the same light as men, because I think the concept still is that you would prefer a male doctor rather than a female doctor.
Meanwhile, Kajee says despite these challenges, women continue to make strides in the sector.
Currently there are more female homeopaths in South Africa than male homeopaths, and we hope that we are part of changing that narrative of being pioneers of homeopathy, and more specifically an accessible form of homeopathic healthcare.
She also addressed what she believes the future is for women of color in the sector.
Women of color could very well be the pioneers in the future of homeopathy and homeopathic healthcare. Because as a Muslim Indian female, I grew up with my mom and the elders of our family often turning to home remedies. And I think because that's built into how we're raised, there's less resistance and there's more acceptance of alternative forms of healing and a more holistic healthcare approach.
The two health practitioners run workshops and special talks for people interested in homeopathy. For Newzroom Afrika on Channel 405, I'm Ahmed Kajee in Rosebank.